All right, so this is going to be part two for the VOMS test, where I go more in depth regarding the assessment. VOMS, otherwise known as the Vestibulo-Ocular Motor Screening Assessment, was developed to assess both vestibular and ocular motor impairments via patient-reported symptoms after each assessment. The test consists of brief assessments in the following five domains: smooth pursuit, saccades, which breaks into both horizontal and vertical, convergence, vestibulo-ocular reflex test, which is also horizontal and vertical planes being tested, and then finally, visual motion sensitivity test. Um, Patients verbally rate changes on a scale of 0 to 10, 0 being no symptoms, 10 being very severe symptoms. They'll be asked about if they have any headaches, dizziness, nausea, or even fogginess after each one of those. And that'll be compared with their pre-assessment baseline scale. The convergence portion of the test was assessed by both reported symptoms and objective measurement of the near point of convergence. This particular test is best to be used following a concussion to evaluate the progression of the patient's clinical manifestations. Also, it'd be great to use this as a preseason baseline tool to compare in case they were to get a concussion in the future. Tools needed to complete this test are a metronome, tape measure, and then a target with a 14-point font, which the last one would be used for the convergence section. I'll go into these more in depth. So first up is the smooth pursuits section, which you're going to be testing the patient's ability to follow a slowly moving target. Both the patient and examiner are seated. The examiner is going to hold a fingertip about 3 feet away from the patient, and the patient is instructed to maintain focus on this target as the examiner moves smoothly in the horizontal direction, 1.5 feet to the right, as well as 1.5 feet to the left of midline. And then this will be assessed in the vertical plane, so going up and down, and then horizontal left to right here. After horizontal section, they'll be asked about their symptoms, 0 to 10, like I mentioned earlier: headache, dizziness, fogginess, any nausea, and then also after the vertical plane assessment there. The target should be moved at a rate of 2 seconds to move the eyes fully upward, and another 2 seconds to move the eyes fully downward. It's going to be 2 complete repetitions up and down as a minimum to do. Next up, we have the saccades portion, which is also going to be horizontal and vertical planes being assessed here. Like before, you're going to assess the symptoms listed before, after the horizontal, and then again after the vertical saccades portion. For the horizontal component, the examiner is going to hold 2 fingers horizontally at a distance of about 3 feet from the patient and 1.5 feet to the right, and then the same distance to the left of midline. The patient performing this test must gaze 30 degrees to the left and to the right. It's very important to instruct the patient to move their eyes as quickly as possible from point to point for an accurate assessment. 1 full repetition is complete when the eyes move back and forth to the starting position for a total of 10 reps performed, and same symptoms are recorded as before. Then you're going to do the same thing, but instead go into up and down vertical plane, assessing that, and then assessing the symptoms afterwards. Following that is the convergence section. With the patient seated, the examiner will now test the ability of the patient to view a near target without double vision. You're going to be going far away, coming near to the nose. The patient focuses on a small target around 14 point size at arm's length and slowly brings it towards the tip of their nose. Patient is going to be instructed to stop moving the target when they see two distinct images or when the examiner observes an outward deviation of one eye. This is going to be then measured in centimeters with a tape measure or roller between the target and the tip of the nose. This will be repeated a total of 3 times with measures recorded each time, and then also again ask the symptoms on a scale of 0 to 10: headache, dizziness, nauseousness, and fogginess. After that is the VOR, vestibulo-ocular reflex test, assessed in both the horizontal and vertical plane. This is going to assess this ability to stabilize vision as the patient's head moves. The examiner holds a target of about 14-point font size in front of a patient in midline at a distance of 3 feet. Both the horizontal and vertical directions, like I mentioned, will be assessed. For the horizontal position, the patient is asked to rotate their head horizontally while maintaining focus on the target. The head's going to be moved at an angle of 20 degrees to each side, and a metronome is used at and maintained at 180 beats per minute, 1 beat in each direction. When the head moves back and forth to the starting position is the completion of 1 full repetition with a total of 10 repetitions performed. Then you're going to have to ask them about their symptoms. For the vertical portion, it's going to be similar as far as the process, except you're going to go into a vertical plane up and down with the patient moving their head vertically there. The visual motion sensitivity test is the last portion of all the domains being evaluated. The examiner will be testing visual motion sensitivity and the ability to inhibit vestibular induced eye movements using vision. The patient stands with feet shoulder width apart, facing a busy area of, if they were in a clinic, let's say a clinic, maybe maintaining focus on their thumb after the patient holds their arms outstretched and focuses on their thumb there. The patient rotates together as a unit, their head, eyes, and trunk at an amplitude of 80 degrees to the right and 80 degrees to the left. Metronome is used to ensure the rotation is maintained at 50 beats a minute, 1 beat in each direction. 1 repetition is completed when the trunk rotates back and forth to the starting position with a total of 5 repetitions performed. You're going to record and ask them about their symptoms, scale to 0 to 10, headache, dizziness, nauseousness, or any fogginess present. Clinical application of the VOMS test is that patients with impairments and symptoms in vestibular and ocular motor function after sport-related concussions can be identified. VOMS is a brief 5 to 10 minute screen for vestibular and ocular motor impairments and symptoms. Also, the sensitivity and specificity values, 96% for sensitivity and 46% for specificity. So pretty solid in, ensuring that you have an accurate diagnosis in the end there. And that is it in regards to the VOMS test. Thank you.